If you're an employee of the state of North Carolina, a teacher or a retiree, here's what's just changed and what it could actually cost you. Let's unpack all these new changes. On Friday, July 10th, the State Health Plan Board voted on a majority overhaul. Starting that date, there will be 4 tiers of providers for people who are covered by the state health plan. Let's break it down. If you see my eyes glance down, it's just because I'm reading the words and I want to get it correct. This is important. So the first level, the top level, is going to be preferred. The next level down will be access. The level down after that will be non-preferred. And at the bottom of the network will be out of network. So again, 4 tiers. Preferred is at the top, access, non-preferred, out of network. And where you go will actually determine how much of your hard-earned money you have to part with. UNC Health and Hospitals and Novant Health are both preferred. That's that top tier. That part has already been confirmed. But here's what just got decided this week. Duke Health and Hospitals is now in the access tier. So they're that tier 2 level care provider. Wake Med, one of the largest hospital systems in Wake County and the surrounding area, has been placed in non-preferred. That's that 3rd tier down, the most expensive tier that's still in network. So non-preferred is in network, but it's at the bottom of the pay schedule. And then there's going to be people that are out of network. So let's talk about the numbers as they will actually impact your life. If you're on a standard plan and you use a preferred provider, that's that top tier, your out-of-pocket maximum that you're going to part with, the money you're going to pay before they pay 100%, is going to drop to $4,000 for the year. That's a decent out-of-pocket maximum, if I'm being blunt. If you use a non-preferred provider like Wake Med, all of a sudden, your out-of-pocket max will jump to $12,000. That's an $8,000 swing for the same kind of care based entirely on which hospital system you may walk into. The officials at Wake Med have said they were blindsided by this decision. They say the state officials didn't share their evaluation criteria and that they gave no real explanation for the decision. Whether you agree with this and how the state chose to treat Wake Med or not is really irrelevant at this point, because the effect on your wallet is the same. If your doctor is in a Wake Med practice, you need to know that now, not when the bills show up in 2027. Also, separately, the insurance administrator is changing. They were on Blue Cross for years. They switched to Aetna in 2023, and now they're switching back to Blue Cross Blue Shield. That's on a different clock. That doesn't happen until January of 2028. There are a few protected groups of people who will not be impacted by the changes as they roll out in January of 2027. If you are pregnant, if you have a newborn that is in the NICU, the neonatal intensive care unit, if you are in active treatment for cancer or a post-transplant patient, you are protected. They cannot force you to change providers in the middle of those huge medical crises. Look, this still is not fully settled out yet. There's a real potential for legal challenges now, just like there was in 2023. Most importantly, we have no idea where in that 4-tier system the independently owned practices will fall. Go ahead now and start asking questions to protect your wallet. My name is Kim Feth. I'm the founder and CEO of Healthcare Survival Kit. I always keep an eye on the news like this, and I try to break it down for you in plain language. Feel free to give me a follow, save this post, or send it to a friend. Thanks so much.